Welcome back to Momarchy, everyone. If you're confused about what is going on with the CDC, vaccine recommendations, childcare, paid leave, all of the things, and who we should go to for science, fact-based guidance, not misinformation, we feel the same. So we're so excited about our guest today, Dr. Megan Pryor, aka Itty Bitty Revolution on Instagram, and she's going to break down a lot of important things for us today. So before we get into it, we wanted to address some pretty big, heartbreaking news, actually, that has happened over the last week.
It has been a really difficult week all over the world. There was the shooting at Brown, and at the time of this recording, the shooter is still at large. We don't know who they are. And then there was the terrorist attack on the Jewish community in Sydney. And it's really hard to, one, talk about this in like such a short amount of time and through such a small lens because there's so many different ways to think about this and talk about this, and everybody really has a different way that they do want to approach it. But one thing that we know is that it's the reality far too often, and things aren't changing, and like we're not safe, and that's really horrible.
Yeah, it's another heartbreaking week, not just in the US, but I think probably for Jewish people everywhere, right? Tanya, like this is terrifying. Like my heart sank when you texted me right after this and was like, I don't think I want to bring my daughter to a candlelight lighting of the first night of Hanukkah, right? Or the second night of Hanukkah
Yeah.
in a public place. And that I am not Jewish, but I feel that with just shootings in general, like you not wanting to go to a concert, not wanting to go bring your kids to something, the mall, the movie theater. Like we've talked a lot about this, but it keeps happening, and we want to make sure that people are aware when these horrific things happen because we cannot be destigmatized to the reality that is our world right now.
Yeah. And as of this recording, which it's December 17th right now, the mass shootings have in the US have outnumbered the number of days. So far we've had 391 mass shootings for the seventh consecutive year, and 75 of them were at schools. And so it's just one, they're really prevalent. It might not be in the news as much. And I think that that's one of the things too, is that people think like, oh, it's actually not happening that much. And it's because it's not being reported on as much. And it's just like, we're kind of numb to it at this point too. And then when you talk about, the targeting of the Jewish community, I think that if you're Jewish, you understand. And when you're not, there's no way for you to. And that's the truth with any minority community, right? We cannot understand somebody else's lived experiences. It's also like, I don't think that people realize how small and close the Jewish community is. And we say that a lot. But for reference, before the Holocaust, there were 16.5 million Jews in the world, 9.5 in Europe. Afterwards, there were 11 million in the world and only like 3.5 million in Europe. And so we haven't
Wow.
even gotten back. Like we haven't even replaced our
Yeah.
population since the Holocaust. And this is something where, like, when you're thinking about how many people are in the world now, absolutely billions and billions. Christianity is the largest religion in the world with 2.4 billion followers. Islam is the second with 1.9 billion. So when you're looking at a Jewish community that is 15.8 at the most worldwide, and 2% of the population in the United States, but it takes up significantly more than 50% of all religiously motivated hate crimes in the United States.
Horrific.
That's crazy. And you cannot tie it to anything involving international events. Like, you can't just say that this is because of Israel and leave it at that and throw it away, because like this was a community event celebrating Hanukkah in Sydney. And to say that it has to do with another country's government is, one, anti-Semitic itself. And like, I don't care if you think it's not, because it is. And I don't think that anybody has the right to define what anti-Semitism is and how you feel, except for the Jewish community. Like, I don't think that you can tell me that something has happened, but it's not because you're being targeted, when like clearly that's the issue. I do want to acknowledge that there are really incredible heroes from this day. So what is it? Ahmed al-Ahmed is the Syrian man who ended up tackling one of the shooters in Sydney, who ultimately killed these the 2 shooters killed 15 Jewish people here, including a Holocaust survivor, including children. And then it's come out with more footage with this couple, Boris and Sophia Gurman, who are 60 years old, fighting a gunman, and they both ultimately end up losing their lives. And so there are really brave people that went in. Thank God for this Syrian man who saved who knows how many lives. And like, he jumped in because he saw people being attacked. And like, your initial response should be, this is horrible. I feel really bad. How can I understand this? And not, how can I explain this away?
Tanya, thank you so much for that. I think it's so critical and important that people hear that message because it's so heartbreaking. It is so sad. And why did these things keep happening? I mean, I think we know some of the reasons why these things keep happening, and it's not okay. And we need to call it out. So, for any listeners that are feeling really hopeless, and we know it is still, it's about to be the new year. We just went into the holiday season. We're coming out of it. We're going into 2026. It's difficult to figure out a way forward sometimes. And so we hope that Momarchy is a place where you can feel heard and seen. And even if like some of these horrific things happen, that that at least we hope that this is a community that can like rally around people and rally around for people when they're feeling really disheartened and disillusioned and heartbroken.
We owe so much more to ourselves, to our family, to our country. I mean, it's so sad. I don't know. A lot of people have seen the interview with the student from Brown who was a Parkland shooting survivor. Like, now people are going through multiple school shootings instead of just going through one. And imagine, like,
Or having to go through any at all. It's unacceptable.
it's absolutely unacceptable. It's not isolated, it's not random stuff, it's not, like, coming out of the blue, and violence doesn't start with bullets, right? It starts with stuff like rhetoric, with flaming hate online, with spreading misinformation.
Divisiveness.
Yeah, stuff on TikTok, stuff that's just like, do your research for what is actually happening and don't trust 100% of what you're seeing online. And also, it starts with legislation. Like, we don't know who the shooter was, we don't know anything about it, but we know enough about mass shootings in general to know that guns are a significant part of the problem.
Yeah. So switching gears a little bit, we wanted people to know that, and this is coming out right now, and there will be probably more updates as the weeks progress and as we head into 2026. We've talked a lot about healthcare and what Medicaid and the effects of the big beautiful bill. So Mike Johnson, the Speaker of the House, recently, I believe it was yesterday, refused to bring the extension of healthcare subsidies to a vote in January. This is something that has been on the news and on social media quite a bit because there are a lot of House Republicans that want to vote on it because it is starting to come out, right? Like trickle effect. And I think this is part of the power of social media and podcast, bringing awareness to the fact that the big beautiful bill and the actions of the administration and Republicans in DC are having an extremely negative effect on everyday lives of Americans. So I think House GOP or House Republicans are seeing that like their constituents' healthcare are going to skyrocket in a few months or are currently because their subsidies will go away. And there will be political repercussions for these people because politics, yes, is perception, but it's also like how much money people are spending, how much money they see in their pocketbook. Like people are going to feel this. People will stop getting healthcare insurance. It is an incredibly scary thing. And it means millions of Americans will go without health insurance, will have to give up other things like childcare. We're about to talk to Dr. Megan Pryor about this. So we just want people to know, like, this is potentially about to happen, and it is a scary thing, and there's not a lot we can do here at Momarchy except tell you to, like, pay attention to who you're your US congressperson, US senator is, call them, make sure that they are aware that this is a huge issue. If you were just choosing your health insurance on the exchange on open enrollment and you saw your prices go up, that is because of the Trump administration. That is because of your Republican congressman or woman, probably, or senator. So please call them. Like, they need to know that this is affecting you and your family and your community.
Yeah, absolutely. We do get more into that the more they hear from you, the less excuse they have to ignore you and your problems when it comes to, you want your children to be safe when you go to school. You want your community to be safe at a Hanukkah celebration. You want to make sure that your family has healthcare and can survive financially the next year. So, yeah, we came in real hot because
Real hot.
we
Lots going on.
there's a lot of stuff to really come in hot about.
Then you should be angry. I just want to say that. I think it's okay to be angry. It's okay, like, as a parent, as someone who just cares deeply about different communities in this world and people's, like, it is so I think I'm just in the, like, angry stage, and that's okay. Like, you can be angry and upset and sad and all the things and feel all the things, and I don't think it always has to be like, "Okay, well, then what are we gonna do?" It's like, well, you can be fucking mad.
Yeah, you can. And I think that, like, for the Jewish community, we are no strangers to hate, violence, people wanting to eradicate us. Unfortunately, it's our entire history. And like this time around, I mean, we always come together and we think about the light through the darkness. Like, there is a reason why we have made it this long with so many people after us. But like, we need help. We can't do this on our own. And we've never faced this kind of surge of misinformation and lies and just swirling around. Honestly, maybe we have, but it's been a really long time. And last time it ended in something horrific. And so, for any of your Jewish neighbors, check in on them. Any of your neighbors that like experience hate, let them know that you are with them and that you want to be a partner instead of just trying to argue against them or figure out why it's not as bad as they're saying.
Well, I can say obviously just for me, but I'm so sorry, Tanya, and for all of our Jewish friends and community members and listeners who are going through this time and trying to grapple with what is happening. Like, I just my heart goes out to you and us at Momarchy. Like, again, we just hope that this is a safe space where you feel that you can listen, you can engage with us. So we're here. We did want to talk a little bit, just switching gears to a more light note, a few things that have come out or will be coming out over the next few weeks. Tanya, I haven't actually asked you about this, but have you watched the Taylor Swift docu-series on Disney Plus yet?
We only watched like the first half of the first episode. I honestly thought that it was like supposed to be a concert. So it's not that I was disappointed, but I was surprised and in a different headspace. But have you?
So we've watched the first two, or I have watched the first two episodes. My husband fell asleep during the first one. Very inspiring. We've talked about Taylor Swift on the pod frequently. You experienced us experiencing the album coming out for the first time. So I think it's great. I love it. I mean, we talk about like needing little things in our life sometimes that are like maybe seem materialistic or silly. But in these dark times that we were just talking about, like, I don't know how you feel, Tanya, but for me, like, those things are really meaningful. Like, they really can help my mental health when I'm feeling like, God, like, fuck everything right now. And I can just sit down and watch this like really inspiring woman, inspiring little girls across the world and talking about like her like the process of how she hired her dance crew and how she wanted them to reflect the world essentially, and it's just like really inspiring and was a nice thing to watch. So I can't wait for by the time this episode comes out, all of 6 episodes will have released for the docu-series. But if you're looking for something to watch over the New Year's, highly recommend.
Absolutely. Can't wait to watch it. And then Traders is looking to cast civilians. So auditions are happening now. If you're interested in Traders, curious to know how the civilian one will go. I think that like the first season might have been civilians plus a sprinkle of celebrities. I don't know. I didn't watch it. I started at season 2, but just everybody. We'd be remiss if we didn't let you know that that is happening and it's your chance to audition.
It sounds like it will be airing on NBC. It will not be a Peacock like the Traders episodes that are out now. But yeah, just Google it. We would love to have a Momarchy fan be on. Maybe we can bring you on to the pod after your experience. We have been talking about like, should we audition? But I don't. Probably not. I'm just too busy. I can't be away from my kids for 4 weeks. That is insane.
I'll bring them. I'll bring Shy.
I'll
I'll
bring them to
stash her in the
the
castle.
castle. I
Well,
know.
so our guest today, Dr. Megan Pryor, you might know her from her Instagram account, Itty Bitty Revolution. Megan lives in Virginia with her husband and 2 kids. She's a pediatrician, a mom, and an advocate for universal childcare and paid leave.
She is known for exploring how policy impacts child and family health outcomes, something we feel strongly about here on Monarchy. We're so excited to get into all of the things with her in just a bit. We're excited to welcome in a new year as well. This is our last episode of 2025. We hope everyone stays safe over the New Year's, and whether you are in bed by 10 or you are out partying at midnight, we hope you're safe and we hope you enjoy with your family and friends. Please make sure to subscribe to Momarchy on Apple Podcasts, Spotify, wherever you get your podcasts. Follow us on Instagram at Momarchy Podcast. Follow us on TikTok, our YouTube. Reminder, we do have a YouTube. You may be watching us right now. So do all of the things. It really helps us out. It helps the podcast grow and it helps more people discover this show. So grab your tea, your hot cocoa, your hot toddy, your mulled wine, your champagne, and let's get into it. Hi, everyone. We want to say a special hello to Dr. Megan Pryor. It's so nice to meet you, and thank you for joining the show. Before we jump in, we're going to do our traditional rapid fire questions for our guests to get to know you. Are you ready?
Yes, I'm ready. Thank you guys for having me.
Perfect. Yeah, we're so excited. I know there's been a lot of demand to talk to a pediatrician, and Sarah and I have wanted this since before day one. So we're so excited to have you here. Okay, number one, as we record this, we are in the midst of the holiday season. Do you have a favorite tradition?
I have one that's kind of new. So there is my community, like our neighborhood puts on a nutcracker, and it's really cute. It's like all of the neighborhood kids. It takes place at our local high school. And so I've not yet let my kids participate because I think it's like 8 shows and I'm not sure I can get ballerinas ready 8 times, but we love attending. And I took my 3-year-old for the first time this year and she was looking at it and she just goes, "This is amazing."
Oh, so cute.
That's so sweet. Oh my God.
So it's fun.
That's really cute. Do you have a New Year's resolution that's worth sharing?
I do. I have one that's actually kind of relevant to podcasts. So I commute to and from work a few times a week, and my commute's pretty long. It's like 45 minutes. And I feel like I've been in a little bit of a podcast rut. And so I've been trying to diversify my podcast listening. And so, yeah, my New Year's goal is to pick a few new podcasts and sort of add those into my mix. So I'm very excited about that. And I'm trying to like branch out in genres too. So yes, come January, I'll be a new podcast listener.
So, what is like your default genre that you go to right now for podcasts?
I unfortunately I'm a politics junkie and I think perhaps that's not ideal for my mental health 100% of the time. So yeah, I want to like diversify fully and just see what's out there.
We love that. We also hope that Monarchy is added to the queue. We try to do some fun. It's not all politics here, but I totally feel you. Like, I always need my call her daddy fix where they just like go and talk about random shit.
Yeah. I think chatting is a nice genre to add in there. Yeah, for sure.
It's wonderful. Well, hot cocoa or hot toddy?
Am I allowed to say mulled wine? I'm the mulled wine gal.
Yes.
That Trader Joe's mulled wine in the microwave, that's my go-to.
I didn't know that that was a thing. So maybe I'll pick that up today.
It's very good. You just pop it in the microwave in a coffee mug, and it is a Christmas delight.
Wow. Okay. I live like 2 hours from a Trader Joe's, but Tanya, next time you go, pick some up for me. I'll get it at your house next time I'm in Denver.
Perfect. I will. All right. New Year's Eve. Are you in bed by 10 or popping champagne at midnight?
I would say typically in bed by 10 or earlier. Though this New Year's, my husband is from Guatemala, and so we are going to Guatemala. and we will be with his much more fun aunt. And so I think she will probably inspire me to stay up later.
Oh, that's so fun.
Yeah, that's awesome. That sounds so cool.
Okay, last but not least, if you could go back to the 90s or the early 2000s and go to any concert, what would it be?
I went to an Alanis Morissette concert when I was in high school. And I don't need to make accusations about her, but I suspect she may have been intoxicated because it didn't go well. And like, I just really had always dreamed of seeing her. And so I think I would try Alanis Morissette one more time because I think I listened to that album, Jagged Little Pill, basically every day of most of my childhood.
If you haven't seen the musical Jagged Little Pill, I
No, I have not.
highly recommend it.
Okay,
It's
so maybe this is my
really,
chance.
really good. Yeah, it was surprising. I had no idea what it was about going in. I thought it was like a bio musical about Alanis Morissette. It is not. um, it is really not. But the music was awesome. So maybe that is your chance.
Okay, good. All right. There's hope.
Megan, Dr. Pryor, thank you so much for joining the show. We are thrilled to have you on today. As Tanya said, surprisingly, Momarchy, we talk a lot about politics and motherhood and the intersection of those two things. And we've had trouble getting a pediatrician on, which is shocking, I guess, especially with everything we talk about. So we're excited to have someone on who is a professional to talk about some of these things that are in the news quite a bit. Obviously, you also run a pretty significant Instagram account. We want to get into that and how people can engage. But we'd love to just talk to you a little more about, like, how did you decide to become a pediatrician? Why did you go into that work?
Yeah, so I mean, I guess I can't really figure out an exact time that I came up with this idea. I went to college and didn't have any clue what I wanted to do. I honestly went to college to play volleyball. And while I was in college, I took a class that talked a lot about HIV. I'm a Libra, and balance and sort of fairness has always been a really key kind of component of my character. And I think I started learning about HIV and how HIV was handled and how incredibly sort of unfair things were. And that really, really bothered me. And so I think what attracted me to medicine was this idea that you can kind of help make life more accessible and more fair for everybody. And so that was sort of where I got into medicine. And then once I got to med school, I loved meeting families. Like I loved seeing people in the context of their families. And I realized that in all the pediatric visits, like you would meet the mom and the dad, and there would be a sibling in the visit. And I loved like the context of families. And so, yeah, I think honestly, just getting to hang out with different families all day was a job that I really wanted to have, and that was sort of why I chose it. And yeah, it's been awesome. I've now practiced. I initially started working after my residency at a health center, a federally qualified health center. So basically, these are sort of like safety net clinics in Virginia, and now I'm at more of an academic medical center in DC.
What's it like being a pediatrician and a mom at the same time? We know that you have two, right? Fairly small children. And that is a whole other, stage of life and commitment and chaos that you have going on. So what obviously, like, tell us, how is that? How is that? What is that like?
I mean, I think it's like any other working parent. Like it is a challenge and it requires a lot of juggling and a lot of balance. I have right now I have a 3-year-old and then I have a 5, kind of almost 6-year-old daughter. And I think, you know, childcare and preschool and support has been the thing that has like held everything together. And so I feel incredibly lucky at the balance that I have of those things. Like I truly could not do it without other people helping. I also live in just like an amazing neighborhood. Like I have great neighbors, and yesterday was crazy hair day at school and I was like texting my next door neighbor being like, I don't know how to do hair. Can you like do my kids' hair? And so I think having people that I can like reach out to who help out and, can share childcare duties really makes my life work. And I think it's been awesome. Like there's so many things as a pediatrician that really obviously translate to parenting. So like I feel very confident handling illness and sort of managing those things. And then simultaneously, there's been a lot of things where I'm like, oh my gosh, raising kids is so much harder than I ever imagined. And I feel like it's giving me much more like empathy in my work of like, wow, all of my patients' parents are working so hard all the time. And sort of I have that context of just how difficult it is to raise kids. So yeah, I don't know. I don't know that I have it down perfect, but I will say kind of year by year things feel more manageable and easier. And shout out to everyone in my life that allows it to be that way.
And how on that point, and we'll kind of get back to the advocacy piece, is you talk a lot about universal childcare, paid leave, and how they affect family values. Like, how, as a pediatrician, as a mom, was that something that was always important to you and something you always believed? Or as went through your schooling and then practiced that you felt more strongly about?
Yeah. So yeah, that story is interesting. So childcare, I will say, is like my kind of number one passion. And I think where I landed there, maybe it started feeling strong when I had my first daughter. So this was about 6 years ago. And I remember I was pregnant, like pretty early in my pregnancy. I think I was only like 3 or 4 months pregnant. And I started touring like daycares nearby where I worked. And so I was like touring daycares, applying, and I wasn't getting into any of them. Like there was just no open spots for infants. And we waited and waited and waited and then finally had her. And that was in 2020. So it was like obviously during kind of peak COVID times. And so all of the childcare centers shut down anyways. But I didn't get a call for a spot for her until she was a year and a half old. And I was like, no, 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 guys. Like, I had to go back to work when she was 3 months. And so we ended up having to do a nanny share and then got a different nanny and then put her in preschool. So, anyways, we came up with like other solutions. And I started feeling this feeling of like, wow, that was really, really hard for me. Like I struggled a lot to make childcare happen. And I also did not get paid maternity leave. So in addition to having to like pay for this incredibly expensive thing that's like many thousands of dollars per month, I didn't have income for 3 months and I'm the primary earner in our house. So that was like a really big deal to just basically lose my family's money for 3 months and then have to pay for this huge thing. And I will also point out that the day I went back to work, my employer was like, "Oh, please give me a check for all the health insurance premiums that we paid like while you're gone." And so I had to like write a
What?
yes, I had to write like a multi-thousand-dollar check that first day.
That's so wild. Is that legal?
It's apparently like I've told other people this and everyone's like, "Yeah, me too. That happened to me too."
So you had to pay your employer for the healthcare that you had.
That we were getting. Yeah. Like, how normally it comes out of your paycheck, but I wasn't getting paychecks. And so then I had to pay that. And so, yeah, so it was just like a rough beginning. And I think the part that I had in my head was like, people look at me as a doctor and people are like, wow, she's lucky. Like, what a good life she has. And I'm like, wait, do you guys not understand? Like, I just got treated kind of frustrated. This was really frustrating and hard. And I didn't even get a childcare spot. And so then I started looking at like my patients and my patients, to be clear, the vast, vast, vast majority are very low income. I see mostly patients that have Medicaid and they really, have access to very little. So at the time I was practicing in Virginia and essentially the way childcare works in Virginia, we have some subsidies. So there's like a federal childcare subsidy program. So each state gets money and families can apply to get that money to help pay for childcare. But in Virginia, like our current wait list now in 2025 is 12,000 children to get those subsidies. So like you can apply, but odds are you're not going to get it. And so then what happens is like if you're a poor family, you can maybe try to get access to the Head Start program, which is another federally funded program. But again, in our area, those spots are incredibly limited. Like there's really just not a lot of them. And so let's say you're a poor family, you've applied to Head Start, you've applied for subsidy, you're not getting either of those. Then, most of the families I work with absolutely cannot afford a nanny. And so they end up having to sort of come up with an alternative. And what that alternative, what I was noticing in clinic frequently is someone in the apartment building. So it's usually a neighbor or a relative, and they end up watching everyone's kids at the same time. So like maybe they'll be like, whatever, the parents will describe 6 or 10 kids all going to the same apartment. And then what actually ends up happening is they all have to bring a tablet or iPad or whatever, because if you get 10 little kids in one apartment, they can't be screaming and running and throwing things and jumping, or they're that person's going to lose their apartment. And so they'll keep them quiet with like iPads. I live in a somewhat urban area, so there's not a lot of places to go out and play. It's really hard to go outside from these buildings. And so these kids are kind of like trapped inside all day long. They're watching iPads all day long. They're snacking all day long. And then as a pediatrician, I start to see the repercussions of that. So, like, I start to see the speech delays. I start to see the social delays. I start to see the worsening obesity, the picky eating, the poor sleep, the behavior problems. And so in my clinic, I was seeing all of these toddlers really, really, really struggling, like in pretty drastic ways. And the thing that all of them had in common was just really poor childcare situations. And I think what really frustrated me was I would put in so much effort. Like I would try to help them apply to Head Start. I would try to help them apply for subsidies. And it was like, it was just not possible. Like those applications were hard, but even once we applied, there was just not a space. Like it would be like, okay, in 2 or 3 years. And so I kind of felt like I just have like my hands tied. Like I can't help these families. Um, and so yeah, eventually that's kind of what drove me to being more vocal about it because it if it's broken for the lowest income families in the United States and it's broken for the highest income families in the United States, like we have a major problem.
Yeah, that's so true. That and we've talked about it before, the wait lists and everything. And like luckily our family is able to have a nanny. And we got on a wait list when I was 4 or 5 months pregnant and she's still not off it and she's a year old. Like that is so significant. And I think that a lot of these people, I mean, a lot of the people who are voting on this stuff, one, can either afford childcare outside of like a system, or two, don't understand the consequences like what you're talking about. Like, this isn't just about a mom staying home and taking care of a kid. Like, it is so much greater than that. And it's, do you think, is there like a country that you think does it well and does it right? Is there an example of what you think should happen?
I mean, I think to be clear, every other developed country does it 1,000 times better than we do. So, like, it's honestly like you can just throw a dart and hit any country, and it will be a better system than the United States has. So, really the amount of money that the United States invests in childcare and preschool is kind of record-settingly low. Like, it is drastically lower than any other developed country. And so, there's programs all over the world that are incredibly effective. If you look at just our neighbors to the north in Canada, their system is a heavily government subsidized $10 a day system. So similar to the US, where basically parents find a center, apply to the center, choose the center. So there's still a lot of parental choice, but then the government pays the majority and then the parent pays $10 a day.
Wow, I had no idea it was $10 a day. That's amazing.
Yeah, so theirs is $10 a day. But again, this is pretty standard. Like in most other countries, this is standard. And so, people in the same way that in the United States, when you think of public school as something that every 5 to 18-year-old should be able to access and that our taxpayer dollars should fund it, that's how most other countries think of childcare and preschool. It's interesting. I now am in DC, and DC is, I would say, probably the best example at the moment, of kind of what childcare and preschool can be. DC invests a lot more than other places do. I will say you guys have probably heard about the like New Mexico childcare thing, but New Mexico is going to get universal childcare, I think, starting very, very soon, which is awesome. But in DC, they've had universal pre-K, so for all 3 and 4 year olds for decades, which is awesome. And then there's no childcare subsidy wait list, and the childcare subsidies are quite generous. So DC itself spends way more on childcare. And so it's funny now that I'm a pediatrician there, it's totally different. Like if I want a kid to get services, if I want a kid to get into good childcare, I can do it in like 2 seconds. So it has really taught me like what a difference this makes. And how I think the other part too that like nobody talks about is so what ends up happening to children with low incomes is they suffer. They just get put in these unideal situations. People with high incomes, they tend not to do that. So they find a way to fix it, but they're suffering too in like quiet ways. Like a lot of times parents are going like part-time at work or they're not taking a promotion or, myself as an example, like I last year did not put anything into my retirement account because like I couldn't because I had to pay for childcare. And so I think like we all make it work, but it's people are still sacrificing.
Yeah, we talk so much about all of these things on the pod. I think your perspective of childcare and paid family and how that does affect family and kids' outcomes is so important, because, I mean, it's just broken. Everything is broken. I mean, we are it's same thing. I'm the primary breadwinner in the family, and we pay $50,000 a year for childcare for our 2 kids, $50,000. That is more than most people make. So, we say this a lot, make that make sense. Like, it doesn't make sense, and then we wonder why, our outcomes are and our health outcomes, our education outcomes when kids get older are the way they are. It's like, well, because we don't invest in our kids, at a when they're very, very young. So, I do have one question before we get into some of the policy stuff, with the CDC and RFK. So, obviously, we found you on Instagram. So, you talk a lot about this online. So, how did you get into advocacy and then influencing online? And why did you go down that route?
I became almost like addicted to learning about childcare policy when I was getting so frustrated. So as I was trying to help patients like get into childcare programs and just meeting like wall after wall after wall, I was like, okay, why is it like this? And so I started reading everything I could about childcare policy and I was learning a lot. And I felt like, you know what? I think there's probably other people that don't know this, that care about this, that want to learn this. And so I initially decided to start an Instagram account basically to share what I was learning. And I also felt like, okay, well, if I'm sharing what I'm learning, it'll hold me accountable to keep learning more. Like if I have to keep sharing, then I have to keep reading. And this will be almost like an accountability tool. So that was one part of it. And then I think the more I've gotten involved in advocacy and sort of political advocacy, I do genuinely think that like public conversation and public opinion matters so much. And so if people are talking about something, if parents are wondering about something, if it's making the news, if it starts to become trending, I do think legislators are more likely to listen. And so I think now I've pivoted to like helping keep this conversation going. And admittedly, childcare policy is like a relatively niche topic. And so I don't think I've ever planned on like, oh, I want to like, make my career influencing, but I think that, really this is the topic I'm super passionate about and the really nice benefit of like going on social media because that was not like a huge social media user at all before this. I started about like a year and a half ago, but it's connected me to really awesome people. Like they're super super smart, interesting people and researchers and scientists who use social media, and so I feel like I've gotten to know them, and it's given me a lot of faith that like there are really good people in the world that want better. So I feel really lucky that it like connected me to people that I want to know.
We're happy to hear that, that there are more people out there. And hopefully, as more people do talk about this on social media, I guess that's the hard part also is that like there's this Maha movement also on social that seems to have a lot of money and a lot of popularity behind it. So we want to get into some of the looming questions a lot of our listeners that we have about the Center for Disease Control Prevention, RFK, the MAHA movement at large. Can you walk us through what the most sweeping changes are right now in pediatric medicine?
Yeah, I mean, I think it's to me a little bit I think of it in a few different kind of buckets. And so I think number 1 is a pediatrician, large political kind of changes, large societal changes impact kids at every level. And so clearly there's been a lot of discussion about fluoride and Tylenol and vaccines, but I also think like what I see impacting my patients honestly even more is I work with a lot of immigrant families. And so like rhetoric around immigration has had a huge impact on the kids that I work with. And so, like I saw a patient earlier this year who was crying hysterically, and this was like an early elementary age kid and was just so worried that one of her best friends would be deported and like didn't want to go to school, didn't want to function. I see families skipping appointments all the time. I recently had a family, um, it's a really sad story, but the parent basically told me that she was needing to immediately go to Mexico because she was not documented and had cancer. She has 2 young kids, and so she couldn't get care for her cancer here. And so she was having to take her 2 young kids who were born in the United States, who go to elementary school here, who've lived their whole lives here, and, like, flee to Mexico with them. They've never been there before. And so, I think the immigration stuff honestly has had a massive impact on my practice and on my patients, and that's been really hard. I think in general, the other thing that like continues to be an issue, and frankly, it was an issue in the last administration too, but the cost of living in the United States is incredibly high. And I think that that really deeply impacts people. I had a patient in clinic recently where I was talking to a teenager alone. And at the end of the visit, I was like, anything else you want to tell me? And she's like, my mom can't afford to buy me a coat. And she like brought that up. And it was real. Like that was her main concern. And she was embarrassed. She was obviously also incredibly cold because it's freezing here right now. And just these basic things. Or like I'll be talking to a parent of a sick child and I'll say, "Oh, you need to buy something to, like, suck their nose out so that they can breathe." And the parent's like, "I can't afford that right now." And so I think, like, the affordability thing is also massive and very much impacting people. So I would say those are sort of like the background issues that impact my care on a daily basis. And obviously, expensive childcare and no paid leave starts those families off with extreme and difficult expenses. And so I think like that financial piece of those things is really important. And then obviously the other kind of piece that it was huge and continues to be huge is the One Big Beautiful Bill Act, puts in place these massive, massive cuts to SNAP and to Medicaid. And those things impact my patients drastically. And so tons of the families I work with rely on SNAP, and so the SNAP cuts started just this past month. And obviously, during the government shutdown, there was also a pause in SNAP. And so many of my families literally cannot purchase food without SNAP. We have a food bank within our clinic where we give people like rice and beans and canned tomatoes and tortillas. And there was like a surge all of a sudden of people wanting bags of food. And so cuts to SNAP impact my patients, cuts to Medicaid significantly impact my patients. And most of the Medicaid cuts, I think, won't happen until after the 2026 like midterm elections. But I do think that will drastically impact the families I work with, my practice. Parents will have to go without insurance, families will be even more financially stressed. So all of this stuff is like massively impacting families that I work with. And then simultaneously, we have somebody running HHS, RFK, who is like making lots and lots of decisions that I don't very much agree with. I think the notion that children in the United States are not doing well is the right notion. Like, I think that's correct. And I think a rise in obesity, a rise in developmental disorders, a rise in mental health problems is the correct assessment. Like, I do not disagree with that. Um, I do think kids are having a really hard time, but I think really all of the solutions that he has proposed are where things are going wrong. And again, I think generally my feeling is that people have kids and immediately they feel an extraordinary amount of logistical and financial stress. And I sort of see that as the root cause of the problem. And I think it's much easier to say, it's Tylenol, it's vaccines, it's fluoride, because those things are really easy to fix. Like, it would be really easy to get rid of all of that stuff, which is kind of what they're trying to do. But I think it's a fake solution to a real problem.
That's interesting and something that I didn't really consider. I mean, knew but didn't really consider is the fact that like he is naming actual problems but giving fake solutions, and how I can understand that as a mom if you're freaking out about something, even if like you do trust something like Tylenol, and all of a sudden this man is saying, "Here's what the problem is." But also, like, it's because of Tylenol. Like, if you hear that solution from somebody in that position of power, it's really confusing.
For sure. No, and I think exactly like it's funny because I think about this all the time as a parent. And so, the food dye thing, people went nuts over that. They're still going nuts over that. And I think as a parent, it's super tempting to be like, wow, if I just make sure my child doesn't eat food dye, they're going to be super well behaved. When like really the solution is like they need to sleep incredibly well. You need to be incredibly patient with them. They need to be fed healthy food. They need to have an excellent childcare situation. They need to have really minimal screen time. And so, like, we know how to support a child's behavior, but the things that we need to do to support a child's behavior are really hard. Like, they're very logistically difficult to accomplish. And cutting food dye out of their diet, that's easy. Like, that's an easy thing to do. And so, I think people are looking for these, like, oh, great, we solved it, like easy solutions. And so, I think that's why so much of what he says appeals to people because it's easy. Like, it's easy to cut food dye out of a diet. It's not easy to get your kid on a great schedule and be patient with them all the time and minimize their screen time and make sure they're socializing and, doing all of that sort of basic stuff right. Like, that stuff is not easy. And frankly, it's not easy because the United States makes sure it's not easy for you. And I think that's the piece that really infuriates me is that there's a way of setting up society to make parenting easier and we don't do it.
I wanna react to that because I think, like, what what I'm hearing from you, which I totally agree with, are, like, the root causes of, like, a structural problem that we're facing in America that is uniquely American, right? And this podcast is not about school shootings, but we talk about school shootings as well and how, they are, uh gun deaths are one of the largest deaths of kids in America. That is also a uniquely American problem. So why are we looking for these like quick fix solutions? These like social media bites that like sound good. And I want to I have a I'm going to get back to the Maha piece because I think that that is a huge problem, right? Like parents of young kids, we're tired. We are just trying to, like, figure it out, and I think some to your point, like, people just want a quick fix, a quick solution, and so to me, it feels like that is a huge reason why MAHA has caught on. There are some things in the MAHA movement, quite frankly, that I am like, "Yeah, I'm all for that." I do think that we should have, I if we can get food dyes out of our foods, great. But to your point, like what I really want is affordable childcare, is universal paid leave for parents, both men and women. So, what do we do, our listeners, Momarchy Nation, moms, parents, when we're hearing things on social media, seeing things on social media that really, are I think the root cause and the reason why people are saying these things is because of the administration, because of RFK, because of, there's thousands of these parents, particularly moms, that are putting out misinformation online. So, what do we do to combat that?
Yeah, I mean, I think it's really tough. And I feel like I'm grateful to have found, there's lots of physicians on the internet that are kind of getting louder and speaking out more and putting their perspective out there. I'm a member of the American Academy of Pediatrics, and I really like the information they've been putting out recently, and I trust them fully. And so I think it is finding sort of good and reliable resources. I think it's so hard. I think confrontational interactions on the internet don't go anywhere. And I also think that a lot of these parents that kind of fall into this line of thinking are surrounded by it 100% of the time. And so asking them to change how they think is almost impossible because it's like there's not a world around them that's offering an alternative. And so I don't know that confrontation on the internet is a solution. I obviously try to have a lot of these conversations in my clinic. And so, I get more and more families asking really specific questions about vaccines and having more skepticism. And so I think we as pediatricians try to put in a lot of effort and education about like, this is why I think it's a good idea. Let me give you a list of ingredients. Let me explain to you what they are. So I do think it requires like a inordinate amount of patience to kind of combat the misinformation. But I'm super worried about it. And frankly, like, I don't think it's possible to combat all of it. And I think, sometimes people just sort of have to learn. And unfortunately, like we are seeing an increased spread of disease. Like there's measles outbreaks in multiple pockets of the country. There's pertussis outbreaks in multiple pockets of the country. And sadly, I think, when it comes to vaccines, people will have to learn. When it comes to learning about the importance of fluoride, once your kid has horrible cavities and needs dental repairs, then you know. And so I think, unfortunately, these lessons do end up teaching themselves. And I hate for it to get to that point because it means kids are suffering. But there's a reason that Western medicine evolved, and there's a reason that we began doing all of these things. And when we stop doing them, people will kind of understand why we got there in the first place.
Megan, thank you for all of that. I think it's so important that we tell our listeners just like some guiding principles, right? Of like, you're not crazy, but like here is what is actually happening, and just like being educated, I think is power, especially for parents. So thank you. So we're going to go into our lightning round of parenting questions. These are questions that we have received from listeners we're going to try to keep the answers really short. So are you ready?
Yes, I'm ready.
Okay. The Hep B vaccine at birth.
I would give it. I gave it to both of my kids.
Fluoride in water.
I'm very pro adding fluoride to water that doesn't have enough fluoride in it. I think people forget that there's a lot of water that has naturally occurring fluoride. And so you should trust your government to make sure that you have the right amount of fluoride in your water. And you can also look it up. So look up and see what your local water has and if they're adding it or if they're not adding it because it's already there.
So wait, really quick follow-up question. I know this is rapid fire, but what about, isn't it like Florida that decided to not do fluoride in water anymore?
I'm not sure. So I don't know. There's certain places that definitely do not add it. And so you should look up to see if your place adds it or not. And again, if where you live doesn't add it, then you can check to see if your naturally occurring water has enough fluoride in it, because sometimes it does. And again, your pediatrician should look this up for you. And then if there's not enough fluoride, you can always take fluoride supplements. And so we prescribe those sometimes that help people who aren't getting it through their water.
We actually do that, Tanya. We don't have fluoride in our water
Oh,
where I live in rural Colorado. So our pediatrician does prescribe, like for my daughter, we have fluoride drops that we put in like her little water bottle. And my son, he has like fluoride tablets that he'll chew.
yep, that's right.
That's interesting. Anyways, how important is it that kids get immunization boosters?
I recommend basically the entire schedule that the American Academy of Pediatrics recommends. And so that would be getting all of your boosters. I think right now everybody asks me all the time about the like RSV, flu, and COVID shots. The RSV shot is available for babies. The flu, I 100% recommend getting it every single year. And then the COVID vaccine, we usually recommend annually, unless your kids had like really difficult challenges with the COVID vaccine in the past. And so you can talk to your doctor about as they get older if they still need to keep getting it.
Should politicians be allowed to give medical advice?
It's not my favorite thing that they do. I think that if they're not doctors, it's probably not like illegal. Obviously, if you're a physician providing medical advice, you are sort of under the purview of your medical board. And it does frustrate me. I have recently seen particular members of Congress giving medical advice as physicians that I disagree with. And I find that to be very frustrating.
Should we be concerned when our toddlers lick every possible toy surface at a children's museum, grocery store, wherever they are?
I wouldn't stress out too much about it, but they may get norovirus, and I'm sorry if that happens to you.
Oh, yep. It's gone through our house several times.
It is very popular right here, right now. I think everybody has it.
And then this is more for parents, but am I sick, sleep deprived, or do I just have allergies?
Oh, good question. Probably all of those things. Yeah, it's tough to be a parent.
Yeah, it is. And then we want to just talk a little bit about like action. So what is an actionable thing that someone can do listening to this episode right now in 2026?
So I think, really my favorite form of advocacy is looking at what do parents and families need to help their kids thrive? Because when parents and families are thriving and their kids are thriving, their health is better. And that matters to me. And so I think Number one is find groups to join and engage with. And so groups that I myself follow pretty closely. I love the group Mother Forward. I love the group Moms Rising. I love the group Moms First, Chamber of Mothers. There's all these sort of advocacy groups that are amazing. And so I would recommend sort of either following or joining one of those groups. I also think telling your story to your legislators, being in contact with your legislators is incredibly important. Like, it is perfectly fine as a mom to schedule a meeting with one of your legislators when they're back in your district and just meet with them and be like, hey, this is what I'm struggling with. It is their literal job to meet with you. And so I would say be brave, call them, email them, and like sit down at a meeting and explain your situation because I think legislators need to hear more from real parents. There's an incredibly small percentage of legislators who actually have young children. And so I think most of them just don't get it. So I'd highly recommend that form of advocacy.
And I think 100%. And there are a lot of legislators who are doing the right thing that one don't hear from constituents saying thank you so much, like this is really important, and so getting the recognition there. And then there are so many that are misinformed, like you're talking about, that parents think, oh no, like what do I even do, I'm gonna have to do this on my own. That like, yes, you should schedule opportunities to talk to them, like have your friends write in letters. Like the more that they hear from you and realize that there are people deeply impacted, like maybe they're heartless and they don't care, but you do not know that until you take a shot, and take your shot.
Yeah, that's how I feel.
And then the last thing I would add on to that, because now that we are, this episode will drop right before the new year, so we're heading into 2026. Like, if you're a legislator, your city council person, whoever, your school board member doesn't represent you, you've tried to reach out, vote them out. Like, you have the power. Moms, parents have the power to vote. Like, register to vote, update your voter registration, go to howthefuckdoivote.com. That's our fun little URL. And make sure your mom friends, your group chat is registered to vote. That's my little plug because we are in an election year. We're about to be. So I think that's so important. There's power in parents.
Yep, for sure.
Awesome. Thank you so much, Dr. Pryor. We want to just kind of round out with a little less intense, kind of a twist on a segment that we usually do, which is I love my husband, but so Jason and Dylan, you get a pass today because we're going into I love my child, but. So are you ready here?
I'm ready.
All right, great. I'll go first. This feels like such a weird segue, but I love my child, Shy. She's adorable, but everything that we own smells really weird. And it's because she has terrible acid reflux that is horrible. She definitely is the one who suffers the most from this, but our entire house smells like regurgitated hypoallergenic formula. And we've gotten so used to it that when like we go in and out of the house, we're like, oh God, this is what everybody smells when they smell us, when they smell our house all the time. So I guess that's mine. I just can't wait to smell a little bit better one day.
In our pediatric training, they make us try all the different formula types, and they make us try that like really broken down elemental one, and it is the grossest thing I've ever tasted. They love it though. I don't know how they drink it. Yeah, they like it.
I think it's because they don't know any better. And so now that I'm like, drink this regular milk, she's like, no, I'd rather have this situation. Sarah.
Oh gosh, so much. I love my children so much. I really do. Obviously, every parent does. My toddler, well, I have two toddlers. My oldest, it's the terrible threes. It's like the like going from 0 to 200 in 2 seconds. It's like, "Oh, we're being so sweet. I love you, mama." And then just like screaming about the most insane thing that happened. And Megan, you said this, like, you need to be patient, you need to take a breath, like, that is so important for your kids. Sometimes it's so hard. It's so hard. So I love my children, but that has been a little bit of a struggle lately. It's okay. Like, we'll get there, but it is a challenge.
Yeah, I'm peak raising a 3-year-old as well. So I guess mine will also be in the same vein. I love my 3-year-old, but this morning I was trying to get her to go to preschool And she was on the floor kicking and screaming. And I'm like, what are we doing? Like, why are you kicking and screaming? And she's like, they make me wear socks at school. And I was like, well, yeah, like it's really cold outside. Like we for sure have to wear socks under our shoes. Like that's made. And she's trying to wear jelly shoes, but it's like 30 degrees here. So I was like, you can't wear jelly shoes. And so yeah, I don't know. It was like quite the morning where I was like, okay, I'm just gonna strap you in a car seat screaming, and we will not be wearing jelly shoes in the wintertime. We made it. She's doing fine. She's there, happy as a clam, I'm sure.
Can I just say too, I mean, I Tanya and I are both millennials and, like, grew up in the '90s, early 2000s when jelly shoes first came onto the scene, and now they're back.
They're back, and they're cute. I love them. I can see why she wants to wear them every day. Like, I get it.
They're so cute. I get it.
But unfortunately, this mean school of hers makes her wear socks.
I feel like they're not that comfortable though. I mean, okay, I haven't tried them since I tried them when I was like 5 and got a blister, so that's just like kind of ingrained in my life. Maybe they're better now.
Yeah, you're right. The blistering at the beginning, I think, can be a thing.
And I guess that, like, any high heels are much worse than any of these shoes, but, like, I should get over my 5-year-old self.
I saw adults wearing jelly shoes last summer, so I don't know if that trend is gonna stick around, but
Kinda hope so now. I went from not liking it, like, a minute ago to being full in, so
Uh, well, Dr. Megan Pryor, thank you so much for joining the show, and I know it's early our time, but it's been, like, a wonderful way to start our morning and welcome us into 2026, so really, really appreciate you. Everyone, if you don't follow Dr. Megan Pryor on Instagram, it's at Itty Bitty Revolution. We'll put it in the show notes as well. Well, we can't thank you enough, for all of your insight and the work that you're doing. I wish that you were in Colorado because then we could send our kids to you.
yeah, that'd be great.
I know all of your patients are so lucky to see you. So we're so grateful, for you and your time, and that you are and there are so many people like you that are just talking about truth and actionable steps that parents can take, and so thank you.
Yeah, well, thank you guys so much for having me. This was awesome.
well, happy New Year, and thanks so much. I'm sure that we'll reach out for some information in the future.
All right, perfect. Happy New Year.
Thank you. Bye.